We are on channel 4. Let's see if our transcripts work. Let's test everything before we start. Can you all hear me? Can you all hear me? Yes? Channel 4. All right. Let's wait if everyone needs to take headphones. All right, I think we can get started, right? All right, so good afternoon to everyone. My name is Luca Bella. I'm professor at FGV Law School, where I direct the Center for Technology and Society. I'm one of the co-founders of the DC3, the Dynamic Coalition on Community Connectivity, which is one of the organizers of this event. We have organized this together with another coalition called the Dynamic Coalition on on data-driven health technologies, led by our friend Amali Mitchen and our co-panelist Amado Espinosa, that should be online. So if we could have actually our online speakers on the screen as well, so that we can have a nice family picture. They should be Amado Espinosa, Oda Shoshi, and Leandro Navarro. If we can have them on screen, that would be useful. So I'm going to quickly present the speakers and then quickly introduce the theme of our session, so that then we can start our conversation. We have here, starting from the left, Renata Santoyo, who is a telecommunications expert and working with the International Affairs Department of Anatel, the Brazilian telecoms regulator. Welcome, Renata. Then we have Talant Sultanov, who is policy advocacy advisor for the Global Digital Inclusion Partnership, an institution I have the great pleasure of sitting in the board of. Welcome, Talant Sultanov. He is also a member of the MAG, the Multi-Stakeholder Advisory Committee of the IGF. Then we have here Osama Manzar, that doesn't need introduction for those who are in the connectivity field. So he is one of the founder and director of the Digital Empowerment Foundation, and he is a senior fellow is a British Chevening Scholar, international visitor of the leadership program of the US State Department. He is also advisor of the Women in Digital Economy Fund and many other very interesting hats that he wears, having connected more than 35 million people in India. Then we have our online speakers. Hope they are already here with us. I see on top of my head on the screen our friend Leandro Navarro. It's a great pleasure to have you with us, even if only online. So he is co-founder of Pangea.org. He is one of the most well-known academics in connectivity studies and community networks. He also is a member of the Gifinet and A-Show-Cat community networks, and has done a lot of very interesting work and studies. Also co-chairs the Internet Research Task Force Working Group Gaia, Global Access to Internet for All. Then we have our friends from the Data-Driven Health Technology Coalition that will be part of the second segment of our session. So we will have Amado Espinosa, who represents the private sector. He has a strong medical informatics background, and he founded the Institute for Medical Informatics at the Autonomous University of Guadalajara in Mexico. And then we will have Houda Choshi, not seeing them on the screen, but I hope they will arrive. So Oda is from Tunisie Telecom. She is a senior engineer, and she is expert also in telecommunications, of course, and cybersecurity. All right. So now that we have introduced all the speakers, let me provide a little bit of introduction as regards the theme of today's session. So first, we are, as I was mentioning, we are splitting this session in two parts, more or less. The first one, we will present some of the finding of this booklet that you can find here and also available online on the IGF website, which is a pretty Byzantine website. So if you want to have a direct link to all the reports that we have been doing over the past years, there is a website called comconnectivity.org where you can freely download all the reports. This year report is dedicated to cybersecurity in community networks. So over the past almost 10 years, 9 years actually, we have been working on a lot of different issues exploring community connectivity. So for those who are new in this field, let me just remind that community networks are community-driven, bottom-up, crowdsourced connectivity initiatives that are usually built in remote area, rural area, or peripheral areas or low income area as an alternative option to connect the unconnected, or to provide better connectivity to the poorly connected, right? So they could be developed by local communities, a group of individuals that have no technical expertise at all. They could be also driven by local administrations, local entrepreneurs. So it's really the beauty of the community network is that it is an effort driven by the local community for the local community. We have explored over the past years how to build community networks, how to regulate them, which funding models are more appropriate for making them sustainable, what is their impact with regard to the promotion of human rights, what is their impact with regard to the promotion of digital sovereignty. They are a very good example of community-driven digital sovereignty, meaning the local communities understanding how the technology works, developing it, and regulating, self-regulating it. Now, something that we have not analyzed yet until this year, are the cybersecurity implication of this, because is a double-edged sword to some extent. The fact that the infrastructure is created by people that do not necessarily have a strong technological background means that a lot of open source infrastructure and equipment is used. Maybe not a lot of knowledge as regards existing legislation that can impinge upon infrastructure like not only telecom legislation, but also we will see data protection regulation that must be complied to and create some cybersecurity issues. So as the beauty of the community network, the fact that they are community driven, can become a vulnerability. The fact that the infrastructure is built without thinking to bad faith actors that can hack the infrastructure, that can transform the infrastructure into a botnet or into a easily targeted with distributed denial of service attacks. The fact that even very basic controls of information security, such as knowing which kind of software you are utilizing, knowing which kind of data you are collecting, having a resiliency plan, having a plan to recovery when you will be attacked, because we know very well that digital pretty much any kind of digital system at some point will be attacked. So if you don't have a recovery plan, a resilience strategy, you are very likely to be highly disappointed. And so these are very similar challenges what community networks face to what also we will see in the second segment, digital data-driven technology in healthcare system face, of course, in very different ways. But we have very similar challenges here dealt with very different ways and very different types of resources as well. Because again, let's remind that these community networks are community-driven, local community-driven. They are not necessarily driven by people with a lot of resources and with a lot of training on cybersecurity, or even with legal training. Some of the points that we raise in the book is that there are almost 160 countries in the world have data protection laws, and if you don't comply with it, you may be not only liable according to civil law, but in some cases even responsible according to criminal law. So when you create a network and you don't consider applicable legislation, basic data information security policies, resilience strategies, plans for recovery in case of cyber attack, mapping the kind of software and data you have at your disposal under your responsibility. Well, that are those are all potential systemic vulnerabilities. Now, after this very long introduction, let me give the floor directly to our speakers. We had planned to start with Renata, but as Osama, who is a very busy man, has to leave us in 15 minutes to go to another session, I would like to redefine slightly our agenda, starting with Osama and then going to Renata, hoping that she is not that she agrees with this. So, Osama, it's a great pleasure to having you with us again. The floor is yours.
Thank you very much. Everybody who knows our work will not expect anything technical that I'm going to talk, because I don't know the technology. We work with communities. I want to give you a little heads up on this chart. This chart is basically the geo map of all the community networks that we have done in the last 15 years. In India, they are 280. That doesn't mean that they are the only community networks. There are many more, but we have been able to do it. And Luca has been able to look at many of those networks and document it also. So there are three things that I want to say. Internet is global, but users are local. Again, internet is global, but community networks are local. Not only local, it's hyper-local. And not only hyper-local, but it is used by those who are otherwise unserved by the telcos, unserved by or underserved by any of the normal telecom service providers. And therefore, these are the people who are non-technical, but still user, and the provider of the network of such people are somebody who is also have to be appropriated locally so that you can manage the network. So I just want to give you a scenario that we go to the village, we find that they are not connected, then we build capacity, then we involve them, and then they build a network or a Wi-Fi and then towers, and then we also work with them how to take care of the network. Now this cybersecurity is the latest elephant in the room of all those people, right? And I'm talking to you everything not from the technology service provider or a server provider, but the people. I am first time introduced to my network. I am getting a message. I am sitting on a computer and working, and my service provider is not AT&T or somebody else, but somebody very local. And then I get a message which says, please click here. And I click that, and I lose money from my bank, right? Then another friend of mine who is actually had no jobs is now working for similar kind of job, who is actually making people fool locally and actually doing cyber frauds, by sending you information, and they are collecting the local numbers, local contacts, and giving it to somebody else, and they are getting messages. And since you are first time user, you are being very naive and very simple that, oh, some message has come, I must act.
Just to stress, this is a hypothetical friend, so he's not describing a real friend.
No. It's a real. In fact, if you come to the next session, I'm going to explain even in detail. But what I am saying is that cyber safety, cyber security, from technical perspective, but from the user perspective, what is the behavioral change we required? What kind of critical digital literacy we required from the user is the biggest issue of this area. But somehow, most of the work that is going on in the cyber security, cyber safety is very technical, as if we think that only firewall will solve all the problems, or we think that just identification of something or surveillance or data protection will solve all the problems. But actually, it will not, because I, as a user, even without violating, I am getting fleeced. I am being compromised. I am being trolled. My online data is being, it's something like I'm a member of a matrimonial site. I have given my face and everything, and then it is just taken from there. and you are sitting just in the corner of a village and you have no idea how to deal with this one. When you go to cybercrime office and do the complaint, they say that even we don't know how to trace such people. Where are they? So I'm not trying to give any solution, but I want to tell that the cyber safety, cyber security, and cyber data protection is not only a subject of top-down model. It is a subject of bottom-up social and behavioral norms-based cyber capacity building. And somehow that is not taken into consideration in most of the planning. And when we are working in an alternative community networks or providing a last mile access, it is very important that we have our own capacity building framework. We have our own content. We have our own local, hyper local, contextual content to make people know what are the do's and don'ts of being connected, to be cyber safe, to be cyber preventive, rather than curative. You must be knowing what are the things that we need to know, and that is what the experience that we are doing in many of our communities. There are three things that we are doing. Number one, we are trying to see if women could take the responsibility of the hyper local situation, so that they do not indulge into unnecessary information flow than what is needed. Education, domestic issues, business, day-to-day lives, and all that. The second thing what we are doing is that we are creating hyper-local information trustees, which you can say information trustee is a describing name, but we are trying to create a situation that they become local fact checkers. They actually tell what are the do's and don'ts of the people who are coming to the center or the place where they get connected. And the third thing is that we are doing a role play of cyber safety security by doing street plays, by doing local language oral content, so that it can be disseminated with lots of people. These are the things that I wanted to share, but basically trying to highlight that the global technology, the global access issues, the problems are always local. And when we are talking about cyber capacity, we need to have a local solutions. Thank you.
Thank you very much, Osama, for this very important words. And again, I think that this is a very key message, and that comes in a very recurrent way in cybersecurity discussion about cyber hygiene, capacity building. At scale, we have reports by Microsoft saying that more than 90% of cyber incidents actually happen because of phishing, and for considering what usually it is considered the weak link, which is what stands between the screen and the chair, the human. But actually, what I think that one can revert this logic through education and capacity building. The individual becomes the strong link. So when you are the ones understanding, and even basic things about cyber hygiene, like do not use 1 2 3 4 5 6 as a password, which is still the most used password. So if you understand this, you really go much farther than at the very early stage, especially in community network, where those who are connected are frequently unconnected. So really is the first approach with technology they have. Now, I would like to give the floor to the regulator. There is already a lot of norms and regulation people need to comply with, and it can also to some extent guide them into the definition of their policy architecture and practices. So please, Renata, it's a pleasure to have you with us. The floor is yours.
Thank you. Thank you very much, Luca. Thank you very much for having us here and invite us as Anatel. So I'm speaking from the perspective from the telecom regulator. And first of all, I'd like to do a very brief historic and an update about our history with community networks. It was something that we started being more involved from 2020, when we had a memorandum of understanding with UK, and we did a work with a partnership with APC, And we have some very interesting outcomes as policy briefing with the framework from the regulatory status, and also a manual for lay people with a video that it was very interesting because we had the opportunity to teach and help community that don't know anything about connectivities or how to deal with regulator to construct their own community network and how to deal with regulator. That's something very complicated sometimes. Which license they need to take, how to use the spectrum to not break any rule. So it was very interesting beginning. After that, we had the opportunity to internalize this work as a temporary committee in Anatel. We had under the presidency of one of our commissioners, and they did this work for a couple of 2 years, and it was very interesting because they had the goal to make some regulatory adjustments. Hearing from network representatives, Ministry of Communication was together, and also service providers. So it was very interesting to map all the situation and the needs, and what kind of regulatory measures we need, and it was necessary. And very recently, like 2 weeks ago, we had this temporary committee. It became a permanent committee, and we have now public consultation. That's also a space to hear from the whole society, civil society, all the actors in this environment. And considering the results of this committee, the intention about this is continuing this important work, improving and solving a lot of remains difficult and challenges. And I can highlight some examples of the proposals that we are doing. First of all, it's interesting to remind that we have a very asymmetric relationship with this comparing community networks to big providers or small providers, because we are not treating them as an equal, and then so it's a possibility to develop more and more the community networks. And in this public consultation that it's now for 45 days since December 5th, they have the proposal about anticipate some benefits of the new act of authorization of use of radio frequencies. Also evaluate adjustments in the regulation on the spectral use to address possible incompatibilities between the application that the community networks that wish to implement in Brazil and the allocation and destination of the frequency band of interest. About fundings, we are forward the Management Board of Telecommunication Services Universalization Fund. That's a very old fund that we have, and it's very difficult to use. And they had some change in the law, so we are trying to use it more and more each day for interesting and useful things like community network. Also, prioritize the penalties, not with fines, but with obligations to do, and prioritizing specific actions aimed at the population served by community networks. And so it's possible to see that we have a lot of challenges. Lack of financial resources is one of them. Regulatory barriers to the establishment of networks, difficult in mapping the benefited communities, obstacles related to geographic isolation, and of course, cybersecurity. And about cybersecurity, we have a specific regulation for the whole ecosystem and cybersecurity. And security, of course, is a priority for us, especially for a successful model of community networks. And in August of this year, Anatel reviewed the cyber regulation And a new article that we have in this review, it's about the telecommunication service providers. They need to communicate any accident, security incident to the National Data Protection Authority. This include community network. That's the way we think we can maintain all the principles and guidelines that apply to all the actors in this ecosystem, large, small providers, also community networks. And we believe that this way the ecosystem can flourish. But they're still being treated as an asymmetric approach, and then we cannot apply the same rules, of course, for the because they are like for us restricted interest. For example, they have a license that's a private limited service, and big providers are collective interest, and so they don't have the same obligations. So it's something to help and to foster the development of community networks. So the principles were maintained, and but as well as this asymmetry in processing this new regulation of cybersecurity. And so we also, to materialize this resolution of cybersecurity, we developed some guidelines that's very interesting of cybersecurity regulation applies to the telecommunication sector, and approved by the Cyber Regulation, emphasizing the adoption of good practice and national and international standards related to cybersecurity. It's all available on the internet, and it promotes the dissemination of a culture of cybersecurity and the safe and sustainable use of telecommunication network and services. This was a work that was developed for our cyber working group, and they prepared also another guide. This one is more basic guide it's more accessible for lay people, and we have also another one that incentivate the security by design and in the development of the softwares. But in this basic guide, that's the first one I was talking about, you can have instructions like data protection, access and account control, activating and monitoring your account, data backup, and all this lot of different instructions just to help. And also in the same way about literacy, we have a partnership with OAS and Cisco Academy to capacity building and to also help to teach how to be more safe when you're navigating and connected on the internet. So I think we believe that all these guides and this partnership with academia, with courses, we kind of lead us for the meaningful connectivity, helping and teaching people how to use internet, because I think that's the third pillar, because we kind of talk about infrastructure, then security, and now we need an effective way to use community networks, right? And have the best they can give you the best performance, and I think that's our measures until now. We are continuing trying to do things, listen to the society. As our friend Osama said, it's not top down. We need to do all together just to see what's the real needs we have. And we are also involved in the Partner to Connect and ITU. We did a pledge about community networks to being followed on WISIS this year. So it was very, very interesting. And it's also on the internet. So I think for now, it's it. Luca.
Thank you very much, Renata. And it's very interesting to understand that there are very few regulators in the world that have had this proactive approach to engage with community networks, try to understand them, reduce also the regulatory burden to facilitate them, because what we have been discussing over the past 10 years is that, of course, you cannot have the same regulation for enormous tech giant, telecom giant, not telecom operators, and small ISPs, micro ISPs, or non-for-profit ISPs. So it's very good that the Brazilian regulator Anatel, together with few others, has had this sensitivity. Now, a very frequent problem in cybersecurity debates is how to identify users, how to make sure that they are not bad faith user, they are the real user they claim to be. And here I wanted to bring to the fore the work that Leandro and his colleagues have conducted and is also described in this booklet about decentralized digital identity and verifiable credentials for members of community networks, which is extremely interesting because it gives us an approach, an understanding of how technical solutions, even not particularly expensive technical solutions, can be used to enormously help people engaging with community networks. So please, Leandro, I hope you are still here. Yes, I see you now. Can we unmute Leandro so that he can present? Welcome, Leandro. We can see now your presentation, almost. Yes, we see it in full screen. Can you speak?
Yes, do you hear me?
Yes, we can hear you loud and clear.
Wonderful. So this is the pattern of representation, but instead of decentralized, could be self-sovereign, digital identity, and verifiable credentials for communities. So this is the work partly funded by the European Commission, but which involves, as you see in the heading, several communities, several organizations that were involved in the development. So just to give you a bit of definitions, we are talking about digital identity ourselves, or things, or content, or organizations that they want to be identified in the cyberspace, let's say. And then there is a concept called decentralized identifiers, which allow you to have different identities, different tags, whatever. Once you have an identity, people, organizations can say something about you. Like, for instance, you as a member of a community, you live there, this is your education, you are a vulnerable person, and there is accreditation from a NGO that knows your situation, something like that. In the end, whatever claims. So this is a bit abstract. And then I'll give you an example. For instance, this is one of my multiple identities, leandro@ereuse.org, which is a community project where we collect and refurbish second-hand devices for community members to be connected, because, well, to connect to the internet, you need a device. And this is my GPG key ID, in case you want to check my mails that come really from me or someone else. So my DID could be, is not exactly like that formally, but could be deep email, leandro@ereuse.org. And then from that, you could find out my public key, whatever, and then verify an email that I send it to you. So in the decentralized ID world, there are, they call it methods. One method is called key. And here you have your public key embedded in this long name or identifier. But also there is the DID-web method that allows you to kind of encode a typical, let's say, website, which identifies my personal identity in the GIFINet network as. And then you see again an ugly kind of JSON data structure that is structured like, imagine like the source code of an email, where there is a part that says who is saying what. This is the GIFINet community network that is saying me as a subject, that I'm this person with this identifier as member of the GIFINet community. And then there is a signature which allows the third party to verify that whatever is said here, who issues the credential, who is the subject of the credential, is valid because there is a signature in it. Well, this is a very technical description of the data structure, but imagine that you have a badge like this, which says that I'm a community member of GIFINet. You can scan it with a QR code. You can verify that this information hasn't been tampered with. And this is my email address and and public key. Okay, so what we can do with this? Well, we can talk about the properties, the rights, the different aspects. What we try to do in this case is we try to develop open source software that works and that allows community networks and other type of communities provide the services on their own. And then, well, you can see that there are strange concepts like the issuer of an organization that says something about me, for instance. So I have a wallet where I can hold these data structures, these badges or credentials, and then different elements that I'm not gonna enter into discussion. If you want to know more, we have a, let's say, public repository on GitHub. You can leave us a star if you like it. And also this is our development repository. So I can tell you a bit more about the pilots, the communities we've been working or we are working with them. So for instance, the first three are three NGOs. Pange is an NGO that I was co-founder for using that identity, which we provide ourselves. Or there is another NGO, SEDEM, also in my neighborhood, let's say. They can use these credentials to access other online shops from other NGOs, and a federation that a federation of NGOs that provides different credentials for instance, when they go and apply for funding, they can accredit that they are members of La Fede, and you can provide this credential to confirm that this is sure and verifiable. And one particular interesting example in this context is this collaboration between Manel is an NGO that works in neighborhoods, in vulnerable neighborhoods, and then they know the families, they issue credentials for them. They might not even have a legal ID at the time, but they can have already an accreditation from this NGO showing their level of vulnerability, so they can use this credential or to a cooperative that provides telecom services and submit that credential, and this third party, they call it verifier, is going to be able to see that this is a vulnerable person according to a criteria without revealing details about them, and with signature that allows to see that it's not themselves who claim being vulnerable, but there is a well-known NGO that accredits that. And the same, we do it for giving like computers, laptops to families or children that need them, and then we manage this kind of multi-organization identity management system in the community. So with this, you can show that you are a member of a certain community, you have a credential from someone else, and go to third parties and prove that this is true. And this model is based on the European blockchain service infrastructure or identity infrastructure that is a bit complex, but you see that there is a public registry of actors, and well, I can have my own credentials issued by, imagine like an NGO that has been accredited by the government or whatever, and then you can submit my credential to any organization in, let's say, Europe or in the world, and be able to prove that this information that I'm submitting is valid and correct, and is, even though I might not have a, let's say, a legal identification myself. So that's a self-sovereign part of it. So we have seen that it's possible to make it work, although complex, of course. And then, well, I mean, just that many details about, there are challenges, of course. We are not finished with this. We are just started 1 year ago. And then, well, it's difficult to do for adoption. It's difficult to manage governance issues. It's difficult to maintain the software and to make it interoperable with third parties, and especially with public services, if any. And then, well, there is a lot of things to do in the future, and keep working with the communities to understand their needs and to address them, and to be able, as with many community networks, to solve the problems on your own, on using free software that enables people not to just let's say do advocacy, but also solve their problems, and with some technical means to include not only digitally but also in the community by providing whatever services to them. So that's my presentation. Any comments, questions are welcome. Thank you.
Thank you very much, Leandro, and to bring this very interesting initiative into the picture, and also to highlight that there are challenges, right? Work in progress, and in one of the challenges also is to make this adopted by the community members, and to educate them in order to understand that this could be a solution for a problem. And as we were mentioning at the very beginning of this session, education, capacity building, and cyber hygiene to some extent is very important. So it's very good that we have here Talant Sultanov speaking about the cyber education and cybersecurity capacity building he has been leading in Kyrgyzstan. So please, Talant, the floor is yours.
It's okay. Thanks so much, Luca. It's a pleasure to be here to present the case from the Kyrgyz Republic. Here I'm wearing the hat of a global digital inclusion partnership where I'm working as a policy advocacy advisor. And I'm happy that Luca is a board member, and this organization is implementing an initiative called Women in Digital Economy Fund, implemented by several organizations, CARE, GSMA, and GDIP. And Osama is actually in the advisory board of Women in Digital Economy Fund. So two of my bosses are in this panel, so I better make a good presentation. And the GDIP and Women in Digital Economy Fund identified 5 core areas where there is the biggest issue with gender gap. And 2 of them are related to, one is access and affordability, and the second area is safety and security online. And I'm glad that in this session we are talking about these 2 issues. And in Kyrgyzstan we have launched community networks, and actually we call Osama the godfather of Kyrgyzstan's community networks. So he mentioned, I think, 380 CNs maybe. We can say plus 2 or 3 in Kyrgyzstan to this map. And what we felt is that once we are connecting the people to the internet for the first time, they are very trusting of the internet. They believe everything that they see there. They believe the people who are there. And we felt responsibility that if we are helping people to get online, we also should equip them with information and skills on being safe on the internet. And that's why we, in parallel, launched a project called Tech for Society, or Technology for Society, where we have initiated several activities. One is a help desk, where citizens and civil society organizations can call and get advice if they are having any issues with cybersecurity. And the logic here was that, for example, private sector can hire cybersecurity experts. Government agencies, they have specialized agencies that protect them. But the civil society organizations and ordinary citizens often left vulnerable. And we thought that we should also help protect through the help desk. Second activity that we are doing is cyber hygiene trainings and training of trainers in local levels, so that then they can continue helping the local communities. And the way we are delivering these messages is oftentimes through traditional storytellers, because we are, as Osama mentioned earlier, working with rural communities. And for example, these storytellers would explain in very basic terms what cyber hygiene means. So one storyteller said that when you leave your house, you lock your door not once but twice, your door and the gate. Same with the password. You should have at least 2-factor authentication and a very strong key. Otherwise, your phone can be broken very quickly. And in addition to these activities, we are doing also research. One research we did is on cyber forensics, and we wanted to see if government is actually prepared to deal with cyber crimes, and we developed some recommendations for our policymakers and regulators in this area. And not to take too much time, I just wanted to conclude with several principles that we have been using in our work. One was rural first. So all our work is focused on rural communities. Second is a local language first. So there are lots of materials if you speak, for example, English or Russian is a lingua franca for us. But in Kyrgyz language, which is our local language, there is very little info. So we've been doing a lot of information in a Kyrgyz language. And another main principle that we've been employing is girls first. So all the activities that we are designing, they should be convenient, safe, and interesting to girls and women in rural communities so that they could be better protected. And with that, I'd like to conclude my part and be ready to respond to questions later on.
Excellent. So as the next segment of the session will be primarily dedicated to data-driven health technology, I think it would be good now to open the floor for comments, reactions, questions from the floor. If you have any, feel free to not to be shy and to raise your hand and ask if a microphone can be yes, we have a question here and three questions. Could we kindly ask to, well, I will give you my mic because I'm pretty sure. Can we bring a mic for the...
Am I audible? Yeah. Thank you. A nice presentation from everyone. I have a question for Sanatia, if I'm pronouncing it right. I'm interested to know what kind of cybersecurity model have you implemented? The narration that you have, the experience and the narration that you have put, the story from your ISPs was nice, but I'm curious more on what kind of models have you implemented in the regulatory process or something.
Thank you. Actually, as a regulator in Brazil, we have a working group in cyber because we are not really responsible for cybersecurity, for example. We are more focused on cyber safety. And we have different institutions, and each one of them has different responsibilities. So we have the army with their responsibilities, we have presidency with their responsibilities, and in Anatel we focused more on safety. As I told before, you have this manual and with some guidelines that try to educate. It's focused more in meaningful connectivity, as trying to open mind to how to defend yourself when you're using the basic risks, the basic cares you need to have. So as a regulator, our responsibility is more focused on this.
Are this material openly accessible to publics?
Yes, it is. I'm not sure if it's on a website. Our website, it's Anatel, that's the name of regulator. But I'm sure it's in Portuguese, but unfortunately, I'm not sure if it's available in English. But yes, it's all available. Yeah, I can. Don't know how can share. I can share I can share with you after the session. No problem.
Thank you.
Thank you for the.
Can I just make a quick compliment also to mention that besides making sure that equipment that is used in Brazil is one of the role of Anatel, also there is a regulation on cybersecurity in the telecom sector that defines specific obligations, such as having a cybersecurity policy or having audit of your equipment, or having the obligation for providers to change the default password, because some of the largest cyber attacks that happened in the past, like the Mirai attack in Germany, it basically infected 1 million routers in one weekend, simply because the seller of the router attackers had kept the default password, and this was very easy for attackers to identify and then to penetrate the network. So having an obligation, a regulatory obligation to change this is a very simple step that can make a huge difference. So that is, again, most of the steps that help increase cybersecurity are not rocket science, and having a regulator that prescribes them, it's an enormous step forward. I see there is another question there, and then there's a gentleman here. Yes.
Yes, thank you. My name is Walter Natris, and I'm a consultant in the Netherlands, but I run one of the dynamic coalitions here on internet standards, security and safety. And I think what you've just been saying is exactly what we're trying to promote. As no matter how good the initiatives we've been hearing are, miss one girl and the whole village is still a botnet. So yes, we have to train at that level, but at the same time they're vulnerable because the service providers higher up do not have a routing security or do not have a DNSSEC security, or they don't have whatever. So people can be attacked where they don't have any influence at all. I can't change my network to DNS security or put in a routing security or whatever. So I think that is where other institutions have to become more proactive to not perhaps regulate in a traditional sense with fines or whatever, but in the way to expose weaknesses in networks. And I'll make a little promotion here, but I've been asked to become the coordinator of a community that's going to be started the next year on internet.nl. And internet.nl is a tool, and look it up, internet.nl, and then put in your local bank, for example, and see how secure it is or it isn't. If we bring organizations together that's going to implement this tool, it's going to expose the weaknesses of your institutions and of your internet service providers, etc. And that also means that they become accountable because it becomes visible. And we have to train people not to be gullible, but on the other hand, we have to make the tech organizations, whether they're small, big or small, more accountable to the tasks that they have, and that one of them should be protecting us as end users. So when you move forward with this initiative, I would suggest that you have these two components in it. You keep training, tremendously important, but also start exposing. And when you expose, people become accountable. Thank you.
This is an excellent comment, and actually the fact, I mean, if we want to add an additional layer on top of your comments, besides training and also making accountable, is also, in my experience, also facilitate to some extent the creation, the integration of these practices, which have a cost. So let's also be honest about it. The reason why most devices or most services may not be cyber secure is because cybersecurity has a cost, and the consumer do not perceive this as a criterion of quality. When they buy something, they want the shiny features. They don't necessarily want the most secure object or service. And if the most secure object and service costs more, they will go for the cheaper one. And if we want to apply this logic to community networks, they are usually created with very cheap Wi-Fi equipment and not necessarily the most secure, right? So something that actually is very interesting also in Brazil is that if you have costs for cybersecurity, now in Brazil you can declare them in your fiscal declaration as costs that are deduced from what you have to pay, which is an enormous incentive. So very few people know it actually in Brazil, but actually there is a very big, if cybersecurity becomes a fiscal advantage, then a lot of more people will do it. Because people, I mean, are from the individual to the large corporation, the rationale is driven by costs. If something is very costly, even if it is an excellent thing, most people maybe will not have the resource to do it. I think that adding this very interesting discourse, also the fact of help facilitating achieving the regulatory result with financial help or tax cuts could be very interesting further element. Yes, sir.
Oh, thank you for the lecture. My name is Momodu Sombai. I'm from Liberia, West Africa. I was I work with the regulator in Liberia, the government. So I was kind of thinking with the community networks, how can we learn from your experience, or are you willing to 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 learn? I mean, to lend us some of the knowledges that you have given, if and when we ask you, or are you willing to help other, like in Africa or in other countries? Thank you.
You know, there is a thriving community network community like in South Africa. We can put you in contact with some of the members of this coalition work there. I don't know if Talent, because Talent has been focusing on Kyrgyzstan, but his work is global. So, and then maybe Anatel wants to do a partnership with their Liberian counterpart. We have here two representatives, so we can discuss this. But I'm pretty sure that Talent could be your man here.
Yeah, thanks so much. It's actually a very good question. I'm very glad that you asked. The Women in Digital Economy Fund, where I'm working, areas in addition to funding for women-led organizations is a policy advocacy for governments in Africa and Asia. And we are publishing this document that's a collection of case studies from around the world on best practices. And one, we would like to disseminate it more widely. I'll share the link. And also we'd like to collect other promising practices from around the world to learn from. So yes, we'd like to share the experiences that could be interesting and relevant to you, and also learn from you as well. So maybe after the meeting we can exchange contacts. And also I wanted to add one interesting fact about the cost that you mentioned. So in Kyrgyzstan they decided to block TikTok, and because it's such a popular application, people still want to access it, and they've been downloading VPN to be able to. And of course they are not downloading the paid quality VPNs, they are downloading the free ones, which come with all kinds of viruses and junk, and they are actually becoming more exposed to dangers than before it was blocked. So that was an interesting lesson for us.
Thank you for this, Talent. Now, I think I'm mindful of time, and we still have 40 minutes, and we have now or maybe less, 30 minutes, and we have to get into exactly 30 minutes, and we have to get into the second segment. Can we have again our online speakers on the screen? Can we have our online speakers on the screen? I saw that also Amali. Amali, do you want to provide some introductory remarks to the second segment? Fantastic. So can we have Amali?
Yes, please. So I'm the coordinator of the Dynamic Coalition on Data-Driven Health Technologies. We're located with the IGF as well. And we have a team here. We have Dr. Huda Chehi. We have Yon Abkut. He should be a co-moderator with me online. I think Dr. Amado may not be with us right now. So what we are a group that looks from the patient or really grassroots level user of the internet services to gain health information. Either it's getting the information or it's connecting. We all know of the telemedicine that we had recently with COVID. It became very important to use the internet connections to get services, maybe from a doctor, maybe from the pharmacy, and so forth. Now, for us, when we see reaching the last mile, it means rural areas, but it also means communities, vulnerable communities in urban areas who can't afford to get the service from an expensive telecom. So they often will use a community internet service to get this information or have this access with the doctors and the pharmacy and so forth. We also have people like the local doctor and the local pharmacy. They may also be using just the community network. Now, we're dealing with health data. It's highly confidential data. And so we are very concerned of the level of security. And it was wonderful to hear all about the initiatives that all of you spoke about. So that's really something wonderful for us to hear. So that's just a little spiel on who we are, and we welcome everyone to join us. So we are very much grassroots. We're very much the end user, supporting healthcare services. I'm going to pass this on to Yon, actually, just perhaps before Huda Chihi gives us presentation, if you can spend 5 minutes. I think there was a couple of questions from our own team as well, and perhaps some other online questions. Over to you, Yon. Hello, Yon.
Yes, I'm switching on. Basically, you said it already. Privacy is a major concern in health, and when data is used for commercial purposes, of course, this is a concern that we should base this on an informed consent and not have it done without the consent of the patients.
Joao, were you there, and would you like to share a comment? Dr. Joao Gomez, are you there?
Is Joao Gomez here? He must be here with us or online? Sorry, Amali.
Online.
Online. Do we have a Joao Gomez online? Do we have? Sorry.
We do. We do.
Sorry. Can you allow Joao Gomez to speak? Can you allow Joao Gomez to speak, please? There is a speaker online called... The name is Joao. The name...
I don't see that speaker currently. Maybe his connection broke down.
So we don't have Joao Gomez. All right. Okay. Okay. Do we have any other speaker from the coalition on data-driven health technologies? Do we have any other speaker?
Dr. Huda Chihi, please.
Fantastic.
Introduce herself.
Hello. Could
Hello.
you hear me, please?
Very well. Go ahead, please.
Okay, thank you so much. Hello, everyone. So thank you so much, Emily, for this great introduction. It's a pleasure being participating in such amazing session. And thank you for joining us. Let me start by sharing my screen and see if it is visible. Could you see it?
We are seeing that you are sharing the screen. Yes. Fantastic. Now it works very well.
That's great. Okay, that's great. Okay, so my today's presentation is about cybersecurity tips and recommendation for digital health. First of all, let me start by presenting the roadmap or the content of today's presentation. I will start by the context. Next, I will highlight the tech solution for healthcare. After that, I will present what are the kind of and different types of cyber attacks in healthcare sector. After that, I will come up to the importance of cybersecurity in healthcare, and I will sum up by the different tips and recommendation and best practices of cybersecurity in healthcare, and I will present the importance of artificial intelligence integration in healthcare. And by the end, I will conclude by the different key takeaways of my presentation. In fact, here we speak nowadays of a paradox of digitalization. In one side, healthcare services improvement with the digitalization, but we find also some threats coming up behind this digitalization. So another important thing is we find that there is a transition of healthcare services due to autonomous application, such as artificial intelligence and machine learning that we will see in further slides. And we speak especially due to COVID-19 in different kind of cyber crimes, which is the result of e-health or remote and virtual application of healthcare. So another important issue is there is a lack of awareness and lack of cyber security tools application in healthcare sectors. So we find that the majority of healthcare centers using the legacy tools, which is useless due to a rise of new and emergence of cyber attacks. Every day we find new emerging of new threats, especially in healthcare sectors, because it's the threat, the life of patients is very important. So nowadays we speak about ransomware as a service. So it's very dangerous for healthcare sector. Another important centers is they don't have the enough budget to improve their healthcare infrastructure that we will highlight in next slides with more details. What are the tech solution application in healthcare sector? So we speak about virtual reality, extended reality, or the metaverse application in healthcare sector. We speak about the blockchain application, the artificial intelligence, machine learning, telemedicine, and which is based in the data storage of patients in the cloud. And we speak the different of e-health, which is enabled basically in the application of internet of medical things. So all of this technology improve the healthcare services due to and make the healthcare services for both the doctors and the patients who suffer from disability, or old people who can't move to hospitals. So in particular, and the application of internet of medical things enable the remote of medical operation and enables improves the experience of patients. So here we highlight the importance of digitalization, but in other side it's very important if we take care of the security threats that we will highlight in next slide. So digital ecosystem is very important for both patients and both medical sector, but because it's enabled a landscape of exchange of and opportunity of improving the quality of digital healthcare services. But to improve the quality of healthcare services, we need to improve the collaboration between the virtual labs and the IT experts that we help healthcare staff to improve the infrastructure with very low costs. And another important thing is we need to improve the skills of healthcare staff to understand the importance of the application and of digital services in safe way without harming the patient life and without harming the infrastructure and leading to disruption or digital of healthcare services. So here the digitalization role here is very important in terms of cost optimization, quality, service quality improvement, and patient experience improvement. Here, another important thing that we need to highlight is the importance is of the adoption and the collaboration with the operator or ISPs offering high quality of connectivity, such as 5G and beyond, to, for example, that help us to improve services if we are in, if we speak about healthcare in metaverse. So let's speak now about the faced challenges. Is we speak about the digital device, especially for hospital or rural areas. They don't have enough connectivity to have to adopt and to exploit the different digitalization services. We speak about bias and inequality. Here, to overcome such kind of problem, we have to convince decision makers, regulators, and policy makers to help these rural areas, hospitals, to have the enough connectivity and to exploit and the benefit of the digitalization. And another challenge is nowadays with the importance of digitalization. We don't know the different number of connected devices in healthcare sectors, which is a very critical issue. So another challenge is related to cybersecurity skills gap. So we have to teach all end users, whether it is patients, where medical sectors, staff, the importance of exploiting the digital intelligence in safe way, especially when we speak about healthcare sectors. And as cybersecurity is very important, and it can help us to create more values rather than be suffering from threats of cyber attacks. Another important issue is to take care of the trust of our patient if we overcome the problems of security and cyber attacks. And we can overcome also the problem of financial problems, especially if we open the door for ransomware that will take we demand a lot of money if they have access to our data. So here we have three pillars. So we have to teach staffs to about the importance of cybersecurity. We have, by this way, they will have enough skills to secure the budget of the healthcare sectors. So, well, let's highlight in this slide or in this step the different cyber attacks that all hospital or healthcare sectors they can suffer from it. We speak about distributed denial of services attacks. It is about digital tasks disruption. Imagine that different we have healthcare staffs doing operation online or conversation with a patient, and we have cyber attacks. So we will have automatic disruption of the operation. And another kind of attacks is related to the overall supply chain. Another kind of cyber risk is related to authorization access to patient data. So some crimes, a kind of cyber crimes, is to have access to patient data, and they will demand a huge money because they have a different information of the healthcare sectors. So we speak about here of two kinds of threats. We find it's about external threats if we speak about DDoS or authorization access to patients' data, or attacks related to supply chain. Another kind of cyber attacks is inside attacks is related to healthcare staff behavior, like phishing emails. They open different kind of URLs without taking without any attention or verification, and they use simple and easy passwords that crimes can find a way to open their emails and have all the data of the overall healthcare organization. Another important thing is the lack of security of healthcare clouds, because with digitalization, the data of different healthcare centers will be stored in the cloud. And if we don't enable or we don't do the healthcare cybersecurity tips and recommendations that I will share in further slides, we will lost all our data. Another important risk is the lack of configuration of the different softwares that we exploit in digital healthcare sectors. So here nowadays with digitalization, healthcare is about data. So we have to know how to secure this data to save all the healthcare sectors. So here, let's start by understand step by step what is the cybersecurity about. It's about the confidentiality, availability, integrity of the information. We should take care of the information, and which is and it is about safety of both the hard and the soft, to enable any resiliency of healthcare services, and to overcome any problem of disruption. So it's about a redirection of cybersecurity for value creation to healthcare sector. So another important thing that we should understand is the use of telemedicine or e-health in a responsible way, and it is about the use and the integration of any digitalization with a responsibility. We should test any new technology, and with all the cybersecurity so recommendation before deploying, and you expose it to all the stuff. We should also upgrade continuously and regularly all our software and medical devices to support all advanced security tools, because vendors always add new features. So we should have the necessary infrastructure that supports these continuous upgrades. And another important issue, to not lose our data, and to not open the door for a ransomware as a service. We should always back up and do the necessary storage strategies in the way that we secure our data, and we don't enable others to theft it or to take it, and to after that exchange with us and demand a huge amount of money. to return our
Sorry,
to give.
Hoda, can we ask you
Sorry.
to wrap up because we are almost
Okay,
out of
okay.
time. Thank you very
Yes,
much.
okay. I forget about the time. Sorry. Okay. So let's move to hospital. The importance of hospital IT infrastructure security is about modernization of the IT medical sector. Another important issue is about network segmentation. It is recommended to segment the network and to use virtual private networks and to enable spam filtering. Another important thing is to do continuous check of any new device is about adopting trust approach, and we should have visibility of all endpoints connected to the internet and use it in healthcare sector. Of course, we should have the leadership and mindset shift toward the importance of cybersecurity and to adopt the necessary policies and decision making toward the cybersecurity strategy implementation in healthcare sector. And for staff, it's important, or patient or end user in general, is important to adopt the strategy of multi-factor authentication and regular password updates, and it's important to adopt accurate configuration of different softwares and firewall in continuous way. Another important thing, just to wrap up, is to collaborate with operator and vendors of trusts and operator or ISPs that have shown mature cybersecurity solution, for example, who have provided or adopting DNSSEC implementation with you, which is a protocol of advanced protocol of cybersecurity. Another important thing is to benefit of artificial intelligence in healthcare. So it's important to adopt the antiviruses that adopt or integrate artificial intelligence and machine learning, because they enable autonomous and advanced monitoring or facing to any threats of cyber attacks. It helps also to improve the threat hunting and threat intelligence assessment. So another important thing we should.
Hello, Huda. Online, we can't hear you.
Yeah, and we cannot hear Huda anymore, but thanks to this very extensive presentation on cybersecurity tips, risks and tips, I think this is the best possible way to conclude our panel.
Okay, could you hear me now?
Yes, I think they'd like.
Yes, because I forget to. There is you demanded something to reactivate my micro, and I missed that. So I can continue with this.
Yeah, I think that we really have to wrap up now. And as you,
Yes.
thank you.
No,
Yes.
no. I have just a few slides. Okay, so just to wrap up, I spoke about the importance of artificial intelligence integration in healthcare. So, but in a responsible way, it's enabled advanced threats or attacks detection in proactive way, but it should be implemented and integrated in a responsible way to overcome any problem of bias, which is based.
All right, fantastic. So I think that we now it's time to wrap up because we are almost being kicked out of this room. So we really have to conclude. And also, as I have to go to another 5 minutes, I will have 4 minutes to go to the toilet between one session and the others. So thank you very much. I would like really to thank all the participants for their very insightful inputs and for their very good contribution for this session. I also want to remind those who are here with us that you can take your complimentary copy of this report that I edited with Dr. Senka Adzic and with the participation of many of the speakers of today on cybersecurity and community networks. The copies are here for you. If you want, you can download them from the website comconnectivity.org, where you can find all the material that could be interesting for you and the Liberian regulator. So yes, we are fine with the workshop of today. Excellent discussion. Thank you very much to everyone, and see you next year. Bye bye.
Bye bye.